South Carolina stores back up and running, but limiting the number of customers allowed inside. And in Georgia, all nail salons, barbershops, massage and tattoo parlors are free to reopen on Friday. Dine-in restaurants and movie theaters, Monday.
We're probably going to see our cases continue to go up, but we're a lot better prepared for that now than we were over a month ago.
In the small town of Albany, Georgia, where deaths are higher than anywhere in the state, the mayor says he was blindsided. Is your city ready to reopen?
We are not ready to reopen. We had 15 funerals this weekend, 5 more deaths. We have 60 people on a ventilator at our hospital.
The governor says he will monitor hotspots and intervene if necessary. But Georgia falls short of White House guidelines, which call for a 2-week downward trend in cases before loosening restrictions. Today, from fellow Republican and South Carolina Senator Lindsey Graham,
I worry about that Georgia is going too far too quick.
With the number of COVID-19 cases nationwide closing in on 800,000, other governors say they are not letting up.
Federal guidance requires a 14-day reduction in COVID positive cases. North Carolina does not meet that criteria.
But with the economy in desperate need of a lifeline, leaders are trying to balance safety measures, knowing that each day shut down hurts families struggling to stay afloat. Steve Patterson is in Las Vegas.
The shutdown is costing Nevada an estimated $2 million every day in gaming tax revenue, while some 300,000 workers seek unemployment help.
Now, for businesses, it's the rush to establish a new protocol. Here at this nail salon, the owner is installing plexiglass shields between the nail technician and the customer, and nobody is allowed inside without a mask. At this Florida doctor's office, this fog machine sanitizes every space twice a day. But for Jimmy Funkhauser and his outdoor gear shop in Colorado, his biggest concern, will his customers feel comfortable coming back?
It's one thing to lose 100% of your business for a month, but to lose 20% of your business over 6 months, that's what actually puts you out of business.
A nation struggling to flatten the curve while supporting the bottom line. Lane Alexander, NBC News, Atlanta.
This is Tom Costello. On the front lines of the COVID-19 fight in Georgia, Emory ER Dr. Justin Schrager and his wife Rachel, an epidemiologist, who took to Twitter in frustration as the governor began easing restrictions in the very state that is home to the CDC. This decision ignores public health guidance and science, and lives will be put at risk unnecessarily.
When we do see another surge, it's going to be people like my husband who are going to be in the hospital, really having to deal with that.
Newborn Sadie was just 2 weeks old when Justin moved out of the house and above the garage, mostly to protect her from the virus. For 6 weeks, the family has seen each other in the backyard, but no hugs. Rachel is all alone with the kids.
I think I cannot do it for 18 months. This is something I cannot sustain for that long.
Nationwide, exhausted healthcare workers are warning against lifting stay-at-home restrictions, fearing hospitals will quickly be overwhelmed by a surge in coronavirus patients. From a Colorado nurse standing his ground to a nursing assistant in Pennsylvania.
If we get a surge more of these COVID-19 cases, we won't be able to handle it.
To New York.
If you want to live, you stay home. My God, don't open up this country.
Ultimately, the decision is up to each governor.
We're not going to allow fatalities to go back up.
Back in Atlanta, Rachel recently tweeted her disappointment that Americans were ignoring social distancing, while Justin worked to save COVID patients. Former President Obama retweeting her message. Justin's hope? The curve will flatten enough so that he can come home.
I'm just going to grab that baby and hug my wife and just go in the house and just spend all day holding the babies.
Tom Costello, NBC News, Washington.
Strongly tied to relaxing the restrictions and reopening the economy, the debate over how much testing is enough. Gabe Gutierrez has that part of the story from New York. At this walk-up testing site in Harlem, concerns not only about the virus spreading, but also the uncertainty.
If you don't test, then you're flying blind. And then eventually, this is going to reoccur again.
This site just opened up yesterday, and there was obviously a huge pent-up demand. This line with people social distancing now stretches around the block.
Today, New York Governor Andrew Cuomo met with President Trump, who argues there is enough testing capacity, but governors aren't fully using it.
Let's just coordinate who does what? What do the states do? What does the federal government do?
Each day, the U.S. is conducting about 45 diagnostic tests for every 100,000 people. To safely reopen, Harvard researchers estimate the country needs to do more than 3 times that.
What is holding us back as a country is a coordinated, serious national response that helps states ramp up testing and make sure that everybody who needs a test can get a test today.
Today, the FDA approved the first in-home test for coronavirus, which will initially be made available to healthcare workers. Many states are ramping up their own testing programs. Bolinas, California plans to test the entire town. NBC's Jake Ward is there.
Volunteer organizers here say they were shocked to discover how easy it was to buy both tests for their more than 1,600 citizens.
We started talking to other labs, expecting that everybody was going to be backed up. And we're surprised to learn that wasn't the case.
But that's just one town. Governor Cuomo argues states will need millions of tests, and the supply chain is broken. The tests require what are called reagents, chemicals that interact with patient samples. Those reagents are often made in China, and right now, they're in short supply. Back in Harlem, 11 parishioners from one church have now lost their lives to COVID-19. Reverend Johnny Green considers it a test of faith.
When my phone rings, I'm always worried, is it going to be another call with bad news?
And Gabe, as the push for more testing continues, I know there's news today on a potential treatment that has been pushed by the president. What can you tell us?
Yes, Lester, the largest study so far, the malaria drug hydroxychloroquine, found no benefit in treating coronavirus at U.S. veterans hospitals. Researchers also reported more deaths among patients who got the drug compared to those given standard care.
Gabe Gutierrez tonight, thank you. We're learning more tonight about the president's announcement that he is issuing an executive order to ban immigration to the U.S. during this crisis. Our Jeff Bennett is at the White House. Jeff, what do we know about this?
Lester, President Trump announced tonight that his new immigration executive order, once it takes effect, will suspend immigration for 60 days. He also says it'll only apply to immigrants seeking permanent residency. It will not apply to those entering on a temporary basis. It's still unclear when he'll sign it. But even without an executive order, immigration during the coronavirus crisis has already slowed dramatically, with the administration imposing broad travel restrictions and suspending immigrant visas. Critics say the order is a political dog whistle aimed at energizing the president's base. Lester?
All right, Jeff Bennett at the White House for us. Thank you. Late today, the Senate approved a new relief bill that includes hundreds of billions of dollars more for small businesses. They, of course, worry about their economic survival, while essential workers are worrying about their health. Here's Miguel Almaguer.
With a $500 billion deal now through the Senate, tonight in Minnesota, Jason and Ruth Ivesdahl, who own a local gym, say they could hire back the 12 employees they were forced to lay off if their small business loan is approved.
Take them off unemployment, put them on salary, and then they can be helping us set up some online training opportunities and classes.
After not getting the money in the first round of the Paycheck Protection Program, the Ivesdahls are hoping they get a piece of the $310 billion additional dollars being put into the forgivable loan program. It comes amid growing concerns for essential workers. At grocery stores nationwide, at least 15 employees have died, and another 2,200 have contracted the coronavirus.
I'm hesitant about going back to work because of what's happened.
Marissa Cabello tested positive after working at a grocery store in Irving, Texas. The county now offering COVID-19 testing to all essential employees.
But there are calls to go further. Some unions believe grocery stores should close their doors to the public, only allowing pickup and delivery service.
As hundreds of employees at Amazon prepare for another walkout this week to demand better protection, several food processing plants across the country are struggling to keep workers safe. Morgan Chesky is in Waterloo, Iowa.
Officials say 90% of new cases here can be traced to this Tyson meat processing plant. The company says it's added safety measures such as temperature scans, but tonight isn't sharing the number of positive cases, nor is it closing.
Tonight, worker safety and small businesses, both threatened by a virus attacking Americans and the economy. Miguel Almaguer, NBC News.
We're back in 6.